Hi everyone, a very happy weekend to you guys. Uh, who's with us this evening? Give me a second, let me try and add Dr. Rao. Okay, we've sent him an invitation. Let's see. Anish, Anupriya, Minali. Hey, you guys, welcome to the chat this evening. Um, Kunal, hi. What's up, you guys? She's waiting for Dr. Rao to join. We have a very interesting chat today. We're talking about the third wave of COVID, and everyone seems to have it. So, Dr. Rao is actually going to answer all our questions on anything related to COVID. So, give us 10 minutes to have an initial conversation. He'll answer questions and take up your questions as and how. Uh, Praneeth, Drishti, welcome you guys. And I'm sorry about yesterday. I had to cancel the predictions reading chat with Tamanna because she had a network issue. So we're doing this now on Wednesday at 6 o'clock. So if you guys were waiting for that one, please join us on Wednesday at 6 o'clock. Let's see why Dr. Rao is unable to join. Give me a second. So I'm going to take a quick second and message him. PP Rao, Siddharth, Anita, Anjali, tons of you guys. Hey, and it's also like a really nice, beautiful, windy day today. What is everyone up to? I hope everyone is staying safe, isolating. Uh, just waiting to see where Dr. Rao is. Can any of you see him online actually? And I hope audio is clear. Ah, he's not able to join. I can see and hear you. Please accept. Let's send him another invitation. Okay, we've sent him one more information. Please bear with us for 2 minutes. We're just trying to get Dr. Rao to join the chat. Hi, Mansi. Who else is with us? Palak. Hey, you guys. Sent you through. I'm good. How are you? I hope everyone is staying safe. I'm actually trying to message Dr. Rao to see if he's been able to join us. I've sent him an invitation, but I don't think he's able to. Hi, Malhar. So, do you guys have any questions today about COVID? We're going to talk about everything concerning COVID, third wave, vaccination, booster shots, how to stay away, what to protect, whatever questions you have. Okay. Dr. Rao is not able to join us. Hit invite. Sahani, please bear with. There you are. Okay, now you've joined. So I've sent you an invitation, Dr. Rao. If you can please accept. If you can please accept my invitation, that would be great. Okay, we've said. There you are. Now we have it.
Hi.
Hi, can you see here? I'm going to push back a little bit. Not visible very clearly.
No, I'm unable to join on the computer. This is on the phone.
Okay, so
Some
phone is
reason
fine.
Yeah.
Phone is fine. It's not a big deal. I'm enjoying the weather at Springs, as you can see. I'm here this
Nice.
evening. Okay, so I'm going to do a quick introduction for you. So Dr. Pradeep Rao is actually the head of and the director of the Urology Department at Global Hospital. He's also a consultant robotic surgeon at the Harkisandas Reliance Hospital. He's a very cool doctor with a ponytail, drives a Mini Cooper, and he's a hardcore foodie. He's also a dear family friend, and more than anything else, he's very, very kind person. He's literally looking after like hundreds of families in our complex, and it's become a joke in our family. PR says, if PR has said it, we have accepted it, and he's the last word for us for everything. So, Dr. Rao, thank you very much for accepting my invitation and joining this chat.
My pleasure,
It's the need
Aanchal.
of the
Thank
hour.
you for your kind words. I'm not sure
My
you're all
pleasure.
accurate there, but I'll
No,
take it.
every one word of it is. So let's dive right in. It's the need of the hour. I think everyone is struggling with this wave right now, and there's this whole meme joke going around that if you don't have friends who have COVID, then you don't have friends, or if you are negative, then please isolate yourself. That's how rampant it seems to be for the time being. So, what is your take on this third wave,
Take on.
Omicron?
So, what we have been seeing over the last month or so is
Yes,
a huge number of cases. Obviously, it's a very highly transmissible variant. If you
right.
come into contact with people who have it, you have an extremely good chance of getting infected. But
Yeah.
the good part is that most of the infections seem to be very mild, and especially in vaccinated people, extremely mild.
Okay.
So we seem to be moving towards a pandemic basically of the unvaccinated, which is what we are
Okay.
seeing in the rest of the world. If you're double
Okay.
vaccinated, then the disease is very, very mild.
Okay.
It's obvious now that vaccination per se doesn't completely protect you from getting infected, but it
Correct.
definitely seems to protect you from any serious illness.
Okay.
This
Okay.
was the case with Delta also. Over the last 6 months, I spoke to our intensivist at Global, and Global has
Right.
been treating a lot of COVID cases since the beginning of the pandemic.
Right. Yes.
And the intensivist said he hardly remembers a patient in the ICU in the last 6 months who had double vaccination more than 15 days ago. So
Amazing.
we've seen very few patients in the ICU who have been double vaccinated. There
So,
there
do you
are
think?
there are the
Yeah.
anecdotal cases, but they're very few.
So, is this because of vaccination, or is it because this variant is less dangerous?
No, this variant has only been seen for the last month or so.
Okay.
I'm talking of the last 6 months to a year
6 months.
already. Yeah,
Right.
since the
Right.
vaccination started coming into effect.
Right.
With this variant, you're not even seeing hospitalizations.
Right.
They're much
Yes.
less. The
Yes.
thing is that the seroprevalence studies and the genome sequencing which is done in Mumbai, it shows that 55 to 60%, or even up to 70% sometimes of the cases are Omicron. But that still
Right.
means 30% of cases are Delta,
Delta.
which was a
Correct.
nasty variant. And
But you still don't
many
have
of the
hospital.
people getting admitted are Delta.
Right.
The question which jumps to mind is obviously that when you get a fever, how do you know which one it is?
Correct.
And since what we are seeing predominantly these days seems to be Omicron, uh, even without the benefit of genome sequencing, it seems to be that way. What I suggest and what I tell people is that wait for 2 or 3 days. If
Okay.
your symptoms disappear in 2 or 3 days, it's very likely that you've been brushed with Omicron and you're going to be okay.
Right.
If the symptoms persist beyond the third day, then yes, you should get tested and get some medical attention.
Got it. Got it. Got it. So,
But
you
there's no
said
reason to panic. The
there's no
way
reason
you
to
should
panic. That's what
panic,
I was
and one of
assuming.
the reasons we have people in the hospital nowadays is because a lot of people say they have comorbidities, they're older, they want to get admitted immediately. We get a lot of pressure on people asking us to admit them straight away, and it's hard convincing them. So I want to tell people not to panic, relax, give it 2 to 3 days. If your infection goes down and your symptoms go away, be fairly sure that you're dealing with a very mild variant of COVID.
Okay, so it's not that people are actually getting serious. It's just that as a precaution, they're admitting themselves
Yes,
into the
there
hospital.
are some people getting serious. Like I said, they probably have Delta and
Delta.
they need treatment. And there is very effective treatments available now for them as long as they get treated in time. So you need to get
Correct.
it before a week of the infection. But if you have it beyond 3 or 4 days, then it's definitely worth consulting your doctor and making sure you get better.
Correct. And you were, when we were talking, you were suggesting to me that because of the Omicron, you think that, and because it's so widespread, that the 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 virus or the danger of the virus is on its way out. I won't say that the virus is on its way out.
One would hope so. Most
Okay.
most viruses tend to mutate to a version which allows them to survive longer.
Okay.
If you see the SARS virus when it came in, it was so virulent and killed so many of the hosts that it couldn't
Right.
spread. And
Right.
that's a bad thing for the virus because you kill the host, it's unable to spread. A dead body
Right.
cannot spread a virus.
Correct. Correct.
Somebody
Correct.
spreads the virus when they're breathing and talking and things like that.
Correct.
So the virus also mutates. And because the virus is one of the most basic structures that we know, just an RNA virus,
Yeah.
it's easy for it to mutate and mutate very fast. And that's one
Okay.
of the reasons you see a lot of mutations being reported from countries which are doing genome sequencing. India doesn't
Right.
tend to do a lot of that unless it's really required because our focus is more on treating our huge population.
Is okay. Okay.
Yeah.
Okay. So,
So
what's your take on this new variant that's been discovered in France, the IHU or whatever?
it really doesn't matter because that's what viruses do. They keep mutating and they keep having new variants. It's not that we can keep track of each one of them. What we need to know is the clinically significant ones which are causing disease and
Right.
bad disease.
Right.
Because even the flu vaccine, which we have had for some years now,
Uh
is
huh.
a quadrivalent shot already because it covers 4 strains.
Correct.
So similarly,
Correct.
you're going to see multiple strains of this virus also. Only the really nasty ones are relevant, and which
Right.
we'll come to know once you begin to see it.
And so, are we expecting any more variants like the Delta, which is likely to create that kind of panic, death rate, hospitalization that we've seen in the past, which was really scary?
It's impossible to tell, but it's likely that once there is a variant which is highly susceptible at being transmitted, like
Yeah.
Omicron, and uh, one of my colleagues actually tweeted the other day that this is more transmissible than any other disease known to mankind. It's on
Right.
a factor
Okay.
of 3 or something like measles.
Okay.
So once you have a variant which is very transmissible, it tends to drown out all the others by
Okay.
becoming the dominant strain. And
Okay.
that's probably a good thing for us because this one seems to be a very mild strain, what we are seeing currently. But my
Okay.
family physician friends tell me that they are seeing unbelievable numbers in their outpatient department of people
Oh,
coming with cough, mild running nose, sore throat, fever, or body ache. These are the basic symptoms that is coming with. A lot of people have running nose, a lot of people have body ache, sore throat, and sometimes a fever for a day or two. And few
okay.
people also have some GI symptoms.
Okay. So how much of this now does involves us, literally cooping ourselves in, not going out, not traveling, this whole curfew after 8 o'clock, 9 o'clock? I don't understand what the logic is. You can get virus
I,
during
I think
the
that
night, but you can't get it during the day.
a senior member of the central government task force has already said in the public domain that uh, he doesn't believe we should be doing test, track, and isolate anymore. And I agree with
Correct.
him. I don't think you should be
Right.
testing extensively for this unless, like I said, the symptoms last beyond the third or fourth day. There's no real
Okay.
point in testing. But it's important
Okay.
to have a good sense of civic sense and isolate yourself from others and stay away
Okay.
from others for at least 5 to 7 days once you get a first symptom.
Okay.
That would be best. I don't see that asymptomatic testing is giving us a lot, especially with the high percentage of false negatives. And that probably
Okay.
is the reason we should not be testing so much. If you have symptoms and you test negative, it doesn't mean you don't have the virus.
Okay.
Only a positive test means something with an RT-PCR or an RAT. That's
Right.
important to
So
remember.
coming to that, there can be a false negative, but there can't be a false positive. That's what you're trying to say.
It's very unlikely to get false positives because
Okay.
the PCR is a very sensitive, a specific test that way. It is looking specifically for RNA from the COVID virus. So if it comes
Okay.
positive, it's very likely that it's positive. It's hard to get a false positive, but it has a very
Okay.
high chance of false negative. Not
Right.
because of the nature of the test. The swab collection may be inadequate. You may not get the right sample, and that's why it has a high chance of false negative. But
Right.
it's around 33% or 35% false negative in RT-PCR and about 60% in an RAT. So
Okay.
don't believe a negative report, but you can believe a positive.
Right. Okay. And so, because this is spreading so fast, do you think we're likely to hit herd immunity faster? Because that's the only way out of the virus. First of all, do you believe that herd immunity is the only way out of this? That the only way out of this is through
See,
this?
from the seroprevalence studies which have been done in various Indian cities, we already had a seropositivity rate of 80 to 90%. In
Okay.
spite of that, this virus is spreading, which
Okay.
means it's escaping those people who are already seropositive and still infecting them. So the
Okay.
variant is getting past your immunity to infect you. That's the
Okay.
bad news. The good news is it's
Okay.
very mild. So
Okay.
it's something like the common cold.
Right, because I know a lot of people who've got it for the second and the third time even.
But they were already seropositive and they still got it.
I this I don't
Getting the common cold once
know. Yeah.
doesn't prevent you from getting it again in 6 months, does it? That's
Okay,
because
right.
that
Yes.
virus tends to
Yes.
mutate and it tends
Yes.
to change.
Right.
So
Right.
you can get this again. It's a similar virus to the common cold or influenza.
Okay. And also, Dr. Rao, what is your message to all these people? And I follow so many people in the Western world and healers, practitioners, life coaches, whatever, health experts. And there is this whole wave abroad that is on this whole trip of, it's my body, my right to choose. I don't want to get vaccinated. This is all a farce. It's the pharma industry business and whatever. So, what is your message to people who.
I think the pharma industry is trying to make money. There are much better ways of going about it than this one.
True.
you
And
you won't
also,
want
I
to
mean,
shut down the whole world. I'm sure even the pharma companies have lost money during this pandemic. You wouldn't want to shut
right.
down. I definitely don't believe all these conspiracy theories, and I believe everybody should be vaccinated and get a booster when you're due one. What we are
Okay.
seeing, the data is very clear. It's clear in France, it's clear in the UK, and clear in the United States. Most of the admitted patients and almost every admitted patient in the ICU is unvaccinated.
Right.
And I think our commissioner had tweeted yesterday that 96% of the oxygen beds in Mumbai are occupied by unvaccinated people.
Right.
So the message
I
is
also read.
clear: you need vaccination; it keeps you safe.
I've also read a few articles on the Guardian and that Wall Street Journal that have said that a lot of individuals who are unvaccinated and have actually promoted not getting vaccinated have unfortunately
I,
passed
I
away.
didn't catch that. I didn't catch that. What was that?
Yeah. No, I'm saying that a lot of people who've been promoting no vaccination have actually passed away of the virus. I mean, I've read a few
Absolutely. I
articles.
think I think we've seen it in the United States. I'm pretty sure we're seeing some of it in India. And
Okay.
like I said, vaccination is essential.
Okay.
In fact, I would say hats off to the people who develop these vaccines so fast. Normally, it takes
Correct.
3 to 5 years to
Correct.
develop a vaccine. These vaccines have been developed in a hurry. They are not perfect because obviously it takes time to get something
Of course.
closer to
Of
perfect.
course.
They're not
Of
perfect,
course.
but they have definitely played a role in beginning to end the pandemic.
Correct, correct. And also, what do you feel about? Like, I just feel that I feel India being the largest producer of vaccines, and because we have such large stocks, why is it that our vaccination process is running so slow? We are only just
I'm
doing
not sure
15 to
we
8.
have stocks.
No,
Uh,
we don't.
no, when we order vaccines, it takes a lot of time for them to come. We have a
Okay,
large country, and you need a huge number of vaccines. They just started vaccinating 15 to 18-year-olds now,
which is
and
a very
I don't think
small
we have
age
adequate stocks.
bracket. But isn't that a very small age bracket? Shouldn't we have started with children faster? And also
But
because I read an article
that's for the
where.
government to answer.
Right. No, because
You
also
need,
I read an article where Serum Institute said that they can easily up the production of vaccine, but there is not that much demand at the time. So, do you have
that's
any
because
idea
there's a
what?
lot of vaccine hesitancy in people in not taking a second dose,
Okay.
which I think is foolish.
Why?
Everybody should go out and convince the people who are not taking it to take their second dose and to get fully vaccinated. It's
Why do you
essential.
feel people are reluctant to take the second dose?
There have been so many, the anti-vaxxing is a big business.
Correct.
There are anti-vaxxers everywhere. They're spreading their lies on WhatsApp. They're spreading their lies all over the place. And unfortunately, the people who believe this, the printed word has a lot of weight. And people follow and believe things they read on social media and WhatsApp, and they get
Right.
convinced by this. It's unfortunate, yeah. Because
Right.
we have vaccinated crores and crores of people with
Correct.
hardly any side effects.
Correct.
So
Correct.
the vaccines are pretty safe. They may not be the most effective ones yet,
Correct.
but they're definitely very safe.
Okay, okay. And also, is it safe for children? I mean, I've had a lot of course, I did a chat last week with Dr. Nihar Parekh, also as a pediatrician, but I wanted to ask you as well that is it safe to give children, newborns, pregnant women? What is your take on
I think
vaccination?
pregnant women is pretty clear that it's safe, but with children, the safety studies have been done for Covaxin and the
Okay,
Zydus Cadila vaccine, and they've been approved for 12 to 18.
Zydus. Okay,
Yeah,
okay,
Zydus and the Covaxin. And of course, in the Western world, Pfizer and Moderna are both approved for kids, I think.
Okay. 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 And how soon do you see this wave passing?
I think it's going up so rapidly that it'll be over in a month.
It'll be over in a
What
month?
goes up so fast tends to go down also equally fast.
Okay.
It'll just
And
infect everybody it has to, because it's really going quickly.
okay, and what are the precautions? I know you said that if you feel the symptoms beyond 2-3 days, be careful and self isolate. If you even if you, but in general,
The
what are the
most
precautions?
important is having civic sense.
Right.
If you have a runny nose, sore throat, fever, body ache, please don't go to work. Sit at home in a room and isolate yourself. The
Okay.
worst thing is that people think they're being heroes by going to work when they're ill, and they
Right.
actually all they're doing is infecting others on the way to their
Correct.
workplace and at the workplace. So it's most
Correct.
important that they learn that civic sense to stay away from big gatherings, from workplaces when they're not well. I think if they
Right.
do that, then the pandemic will be controlled to a large extent.
Okay.
And use masks where appropriate, especially in air-conditioned environments where there are a lot of people. It's essential.
Okay. In closed environments and in AC environments.
Absolutely, yeah.
Okay. But open air is safe. Open
What is
air
that?
is safe. The open
Open
air
air
is
is much
very
safer. Yeah, much safer. You're
right.
unlikely to get, where you're sitting, I can see a lot of breeze. You're
Right.
not going to get infected there. It's very unlikely.
So I know you have been telling us this pretty much since the start of the pandemic. That it's the enclosed spaces that are dangerous. Open air spaces are fairly safe. Walking next to someone is you're less likely to get infected rather than face to face with someone. But then still there is this whole government regulation of wearing a mask outdoors, of not walking in the evenings. It's according to me, it's really stupid. I mean, this whole
But the
don't be
WHO
outside.
and CDC regulations for masks and guidance on mask usage have remained the same from the beginning. You don't need a mask in open spaces, and you need it when you're in a closed space. But unfortunately, our government has chosen its own mask regulations. Uh,
Right.
they may feel that people may not follow the letter to a T, and just find it easier to tell everybody to wear a mask at all times.
Right.
It's possible,
Look,
yeah.
yeah, but also like they're fine if you're walking around outside without a mask, which is really stupid.
That's absurd, really.
And after 7 o'clock, you can't walk. I mean, I don't understand the logic that you cannot contract it in a restaurant at 12, but after 7 in the open air, if you're walking, you can contract. How does any of this make sense?
Yeah, I think the virus spreads more at night.
Okay, so I'm going to ask our viewers now if they have any questions for you, and if I've missed out on any information or any this thing, and if you'd like to really share something with us, please do so, because I know a lot of people are living in fear, and I thought it was very important to do this chat today with you.
Oh, most welcome. If anybody has a question, I'm happy to take.
Yeah, and in the meantime, if I've missed out on anything, please feel free to,
No, I think that with the rapidity with which this is spreading, I hope we are getting close to the end of this pandemic, and our life returns back to normal within a month or two.
really, you think that soon we're that close?
I think the virus may go away, but I don't know about our rulers what they think.
Okay.
That may take a bit longer.
Okay. Thank you so much, Dr. Rao. It was really a pleasure to have you. Once again, we have a question. How to convince people for vaccine as they don't want to? That's what we were just talking about. Akash
Yeah.
wants to know.
I think the one fact which stands out to me is that you hardly have any vaccinated person in the ICU and on
Yeah.
oxygen. It's
Yeah.
only the unvaccinated. That's the one data which is very relevant, and we should tell people that the vaccination helps. For me,
Right.
that stands out. And
Right. Of
with the
course.
numbers that we are seeing, it absolutely stands out.
Yeah, because there can't be any better proof than the fact that
Yeah.
you're not going to actually die with that. Okay, someone's asking, Chaya's asking if I'm infected. RT-PCR confirms it today. Then since when has she been spreading it?
So this is next to impossible to tell, because the RT-PCR may be positive for up to 12 weeks after you're infected.
Oh, okay.
So that's why my suggestion is that the minute you have even minimal symptoms, sit at home. Much more important than doing an RT-PCR. If you do an RT-PCR, if you're positive, it doesn't tell you since when you are positive. If you're negative, it doesn't tell you for sure that you're positive or negative. So I
Right.
would suggest follow the symptoms is a lot more important. Common sense and past knowledge tells us that you were infective for a day or two before getting the symptom, but it's next to impossible to tell. You cannot ask everybody to do a test every day. And as it is, the test is not 100% sensitive. If there was a
Correct.
100% sensitive test, you could test everybody. But when you
Right.
don't have a 100% sensitive test, it doesn't make sense. So it's best to follow the symptoms.
And how long after an RT-PCR are you likely to continue to be a carrier of the?
No, that's what I said. The RT-PCR just tells you you're positive. It means it's detected virus particles. It may be live virus. It may be dead virus. And uh, we have seen people coming positive in the RT-PCR for 8 to 10, 12 weeks after the uh,
Right.
infection, actual infection, when they're no
Right.
longer infective. A better rule of thumb is the CDC's original guideline with the alpha and delta variants was 10 days after the first symptom you are infected.
Symptom.
Yeah. And now with Omicron, they said 5 days.
Right.
So
Okay.
I think that we should stick to that. If it's a mild infection in 5 days, you're no longer infective. With a more severe infection, it's 10 days. But your RT-PCR may come to be positive even after that. It doesn't.
Irrespective.
That's
Got
why I'm
it.
saying don't repeat an RT-PCR. Once you got a positive, you know you're infected. A
Got
repeat
it.
is never going to help you.
Got it. Got it. Got it. If I have done my RT-PCR but went through the symptoms, how will I know that I have COVID now? That's what doctor's saying. That even if you feel the symptoms, isolate yourself and give it 5 or 10 days.
Yeah.
Is that right?
Yes, absolutely. Somebody is asking about home treatment for COVID cure with diabetic people. There is no treatment for COVID. I mean, for severe infection, you have antibody cocktail and you have remdesivir. But otherwise, there's no specific treatment otherwise for COVID. There's one drug now called molnupiravir. But none of these should be given in a home setting, according to me. You need to see a doctor and get treated. If your symptoms last beyond 3 or 4 days, please consult your doctor.
What is your take on this cocktail medicine? I know a lot of people are talking about it, but so many people are ignorant about it. What exactly is
It
it
was
and
very
how does it
effective
work?
with Delta. I'm not so sure that it works with Omicron, but this is not
Okay.
required for Omicron because most of the patients are fine in a day or two.
Okay. And what is this medicine actually? Why is it called a cocktail?
It's a cocktail of 2 different antibodies.
Acha, okay. Okay. And it just so it helps immediately, like in a day or two. Is that
Yeah,
what
it
it is?
helps immediately,
Okay. Should I do
especially in
antibody?
unvaccinated people.
Okay. 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 Should you do an antibody if need RT-PCR? I don't know what that means. Should
So
you do an antibody test?
antibody test is if you want to prove that you are infected.
Okay.
If you get a nucleocapsid antibody positive, that means you had a infection of COVID, not the vaccine. It's not the vaccine will not make it positive.
Okay. 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 Thank you so much, Dr. Rao. You guys, what are the symptoms of Omicron? Cold,
I
cough,
told you already,
fever.
sore throat, running nose, and fever seem to be the 3 commonest things, and body ache.
Okay. 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 To our viewers, if you have any questions, please follow Dr. Rao. Please feel free to DM him your questions. If he has the time, he will answer. We're back for our next chat on Wednesday with Tamanna to take up on the predictions that we left off. One last question. How different are they from Delta, the Omicron symptoms?
In Delta, the fever lasts beyond 3 days. Your saturation may drop. It's a lower respiratory tract infection. Omicron doesn't affect the lower respiratory tract, it's upper respiratory tract. So it's much milder.
Okay. All right. Thank you so much.
Welcome.
Thank you for
Welcome,
taking time
Aanchal.
out and doing this
Been a
chat with
pleasure.
me. As
Been a
always.
pleasure.
Thank you.
Yeah.
Thank you,
Thank
Dr.
you.
Rao.